Sir, good morning, sir.
ನಮಸ್ತೆ ಸರ್. ನಮಸ್ತೆ ಸರ್.
ನಮಸ್ತೆ ಸರ್, ಸ್ಟಾರ್ಟ್ ಮಾಡುವ.
ಶೂರ್, ಸ್ಟಾರ್ಟ್ ಮಾಡು ಸರ್.
Okay.
Good morning, all. A warm welcome from Indian Institute of Ayurveda and Rasa Shastra. Yesterday, we had a wonderful session from Dr. Gopikrishna S. Sir. So today, we have a continuation of the session where Sir will be explaining in detail about the clinical applications, the Agada which has been used for those disease conditions which was explained yesterday. So Dr. Gopikrishna Sir is an assistant professor at VPSV Ayurveda College, Kottakkal. A warm welcome from the team of IAAR, sir.
Most welcome, sir.
Thank you.
So there is some network glitch, I guess. Okay. Hello.
Sir, is it audible?
Shall we begin, sir?
Yes.
Yeah. Please.
Shall we begin? Am I audible now?
Yeah.
Is it audible now?
Yes, sir.
Yeah.
Yes. I will turn the video off. Is the slide visible?
Yeah,
Yes,
slides
sir.
are visible, but
Is the slide visible?
yeah.
Voice is echoing.
The voice is not clear, sir.
We'll begin. वागर्थाविव संप्रक्तौ वागर्थ प्रतिपत्तये जगतः पितरौ वन्दे पार्वती परमेश्वरौ. In the again. Okay, 1 minute. Is it clear now? Is
Yes,
it clear
sir.
now?
Yes, sir.
Is it clear now?
Yes, sir. It is clear.
In the yesterday's discussion on the management of the clinical condition in the lines of the concepts of Agada Tantra, we discussed about the cases, we discussed about how to approach for the diseases. In today's session, the second session, we will be discussing about a few Vishahara yogas which we can use in our clinical practice. The first and foremost thing that we have to keep in our mind is an Agada yoga can be used.
Sorry to interrupt, sir. There is again disturbance with the voice. Hello.
echoing or is it echoing?
No, sir.
No,
It
sir.
is
It's
breaking.
ಉಂಟಾ?
ಬ್ರೇಕ್ ಆಗ್ತಾ ಇದೆ ಸರ್ ವಾಯ್ಸ್.
ಈಗ ಕೇಳ್ತಾ ಇದೆಯಾ?
ಹಾ, ಇವಾಗ ಕೇಳ್ತಾ ಇದೆ ಸರ್.
Yeah.
ಇವಾಗ ಕೇಳ್ತಾ ಇದೆಯಾ?
ಕೇಳ್ತಾ ಇದೆ.
ಇವಾಗ ಕೇಳ್ತಾ ಇದೆ ಸರ್.
ನಾನದು ಇಯರ್ಫೋನ್ ಇಟ್ರೆ ಏನೋ ಎಕೋ ಬರ್ತಾ ಉಂಟು ಅಲ್ಲಿ. ಫೋನ್ ಹತ್ರ ಇಟ್ರು ಬರ್ತಾ ಉಂಟು. ಐ ಥಿಂಕ್ ಸೊ. ಐ ಕೀಪ್ ದ ಫೋನ್.
ಓಕೆ ಸರ್, ಎಕೋ ಅಲ್ಲ, ವಾಯ್ಸ್ ಬ್ರೇಕ್ ಆಗ್ತಾ ಇದೆ.
ಹೌದಾ? ನೆಟ್ವರ್ಕ್ ಅನ್ಸ್ಟೇಬಲ್ ತೋರಿಸ್ತಾ ಉಂಟು ಇವತ್ತು, ಯಾಕೋ ಗೊತ್ತಿಲ್ಲ. ಇವತ್ತು ನಾನು ರಜೆಯಲ್ಲಿದ್ದೆ. ಅಲ್ಲಿ ಕಾಲೇಜಲ್ಲಿ ಸಿಕ್ಕುವಾಗ ಇಲ್ಲಿ ಈಗ ಕ್ಲಿಯರ್ ಉಂಟಲ್ಲ ವಾಯ್ಸ್?
ಹಾ, ಇವಾಗ ಕ್ಲಿಯರ್ ಇದೆ ಸರ್.
ಕ್ಲಿಯರ್ ಉಂಟು ಸರ್ ಈಗ ವಾಯ್ಸ್.
ಎಸ್ ಸರ್. Slides are visible?
Yes.
Yeah.
Okay. So, before going to the medicines, let us see how the yogas we can use, in what are all the ways we can use. It's a universal law, universal rule in Agada Tantra that unless and until the application and formulation is specified, we can use it in any methods, any modes. For example, Bilvadivati, it is specifically mentioned that we can give it in the form of Pana, Anjana, Nasya, and one more thing, Lepa, we can use for Lepa also. But in another yoga, there is a yoga called Nalpamaradi Kashaya. Nalpamaradi Kashayam is another yoga mentioned in the context of Samanya Jangama Vishachikitsa, where it has to be used externally because it is specifically mentioned. And another yoga is Neeli Tulasyadi. Neeli Tulasyadi is a yoga mentioned in Vishavaidya Josnika, a Malayalam textbook of Vishachikitsa. There, the formulation is mentioned. We can prepare Kashaya, we can prepare Taila, we can prepare Grita, and Kashaya can be given internally and it can be used for Parisheka also. So this freedom is available in a Vishahara yoga mentioned in the textbook of Agada Tantra. And one more thing is, all the Agada yogas are Rasayana by its nature. By default, it is Rasayana. We can remember the Ashtanga reference from Ashtanga Hridaya. While detailing about the Ashtangas, it is mentioned that Shalya Tantra and Vishachikitsa followed by Rasayana Chikitsa, and Vishachikitsa is incomplete without Rasayana. So before Rasayana, it is a customary that Shodhana should be done, but not in the case of Vishachikitsa or the yogas mentioned in Vishachikitsa. We can try, we can afford, if the situation demands, directly prescribing an Agada yoga, which is Rasayana by default. This holds good in the cases of managing acute cases. For example, Jiva Raksha Gutika is one Agada yoga mentioned in Prayoga Samuchayam, which is mentioned in the first line of management of snake bites. But we have made it a habit of writing it as a Rasayana in the case of chronic non-healing skin lesions or autoimmune disorders. Because of this principle that an Agada yoga can act as a Vishahara yoga, at the same time it acts as a Rasayana. Only thing is that we should be very pertinent about the Anupana, Pathya and its dose. Now, this is a reference which we get in Sutrasthana of Charaka Samhita, where he mentions Annadvishashardayanto Jata.
Sir, your voice is gone. We can't hear you.
So, there is a word
Again,
been
it's
placed.
yeah.
Oh, my network connection is unstable.
Oh.
Is it audible?
Yes, now it's audible.
It is showing proper.
Yeah, now it is audible, sir.
Okay. This is the reference from Charaka Sutrasthana, and the context is Asnehya, where the Snehapana should not be given to these patients. They are Annadvishaschardayanto Jatarama Gararditaha Durbalascha Pratantascha Snehaglana Madaturaha. The reference goes on, but our area of interest I have already marked in it, Gara. A case of Gara should not be given Snehapana. He should not be given Snehapana. And in the cases of any Kapha Prakopita Avastha, we discussed theoretical references yesterday, but not always is the practicability of this Asnehya reference. There is a concept called Hridaya Varana in Agatantra, and Hridaya Avarana means Hridaya Prachadanam. The commentary says Hridaya Prachadanam. This is reference from Sushruta, and in the 24-fold treatments, Chaturvimshati Upakrama mentioned by Charaka in the context of Vishajigitsa, Hridaya Varana is one. Yesterday, if we see the yesterday's presentation and slides, we can see I have mentioned about 24 principles. Out of those 24 principles, only Vasti is not mentioned in it. But Vasti is very much applicable in the case of Vata Prakopita Avastha of a Visha in Jirna Avastha. That too, we told in Luta Visha, Vasti can be given. But one more word was there in those 24 Upakramas, namely Hridaya Varana. This Hridaya Varana can be given on daily basis in order to protect the Hridaya. Hridaya is a marma, and there are n number of cases where Ojas is affected. So
We can't hear you again.
Means Grita is one of the medications that we visible. Are the slides visible?
Yes, sir, slides are visible.
Slides are visible and we can hear you when you say unimportant things, but as soon as you start saying important things, the audio goes out.
Goes off. I will do one thing. I will remove my headset and then speak. I think that will be better.
Yes, sure, sir.
It's quite a bit bright, sunny day today, but still I don't know why network is causing trouble.
Yeah.
So we are well aware that Hridaya is the seat of Ojas. Is the seat of clinical condition where Ojas is to be protected, like motor neuron disease or Dhatu Kshayajanya Avastha, or especially in the context best treatment that is mentioned to protect the Ojas and maintain the level of Ojas. And Hridaya is the seat of Ojas. If we see the ingredients, what are all the things we can use for Hridaya Varana? It is mentioned as Grita can be given, and Grita has to be given in the condition where Dhatu Kshaya is there. So definitely we can give Snehapana in a daily basis in a Shamana Matra for such clinical condition. A classical example is Vata Vyadhi, or giving Kalyanaka Grita, which is comparatively Tikshna. Now I am using a word Tikshna together while mentioning about a Grita Yoga. The examples are also very characteristic. We can give Grita, or we have to give Grita, like Kalyanaka Grita, Panchagavya Grita, or a milder sort of Grita like Dadimadi Grita also, which is mentioned in the Panduroga Chikitsa Adhyaya. Yesterday, theoretical aspect we mentioned how to prescribe the yoga in Pandu, which is also relevant to Visha. So Grita Yoga is an inevitable factor. So Asnehya is not applicable in all condition. If we see Kalyanaka Grita, Gara is one indication. So in the conditions where we see Gara, once a proper Shodhana is done, we can use it as a Rasayana for protecting Ojas. So 10 ml of Kalyanaka Grita every day, empty stomach, with a gap of 1 hour to the food, can be very confidently prescribed. But only thing is that the yoga should be a comparatively Tikshna Gunayukta, Tikshna Swabhavyukta Grita. I already told the two choice, Kalyanaka Grita and Panchagavya Grita. Both are mentioned in Unmada, and we saw Gara and Unmada relation we saw yesterday. That slide I have shown in Charakanida, Chikitsasthana, while mentioning about Nidana. If Gara is the Nidana, do Shodhana with the Kalyanaka Grita as a Shodhananga Snehapana and give Rasayana in the form of Kalyanaka Grita in a milder dose. This is the only applicable thing about Garavisha. Next, this is the first yoga that we are going to discuss today. Bilwadi Agada, it is available, but again, whatever yoga are available in the market, they have limitations. So my humble request is, if we want to practice to the level that we are confident enough of the condition and we are expecting a quantity of an amount of success in the patient, it is better to keep the medicine which is prepared by ourselves, or else we should be having a good medical person or a paramedical person who can prepare the medicines and supply it to you. So such things we have to keep in mind while practicing such medicines. I prepare Bilwadi, I prepare Visha Bilwadi, and all the medicines which I have written now are easy to prepare and easily procurable drugs are there. The first yoga is Bilwadi. It is considered to be the best Vishahara Aushadha as far as its toxicity is also concerned. And the ingredients, I won't go to the ingredients, I will tell only the applicabilities. I will share the slides, I will give slides to Gopi Krishna sir so that you can refer the ingredients later. I will only tell the changes in preparation, if any. It is very easy to prepare. All the drugs are available, and the target drugs in this are Nata or Tagara. Tagara is a very, very inevitable drug in it. So as Karanja. So these two drugs should be very genuine in nature when you prescribe. When you search for this, Tagara and Karanja should be the best quality. So, and it's as far as its applicability is concerned now. In what are all the conditions we can give? Bilwadi Gutika is Vata Kapahara in nature. Vata Kapahara in nature. It is Tikshna Gunayukta Dravya. And it should be given with a proper Anupana depending upon the condition. Even in snake bites we can use, and it can be given in the GIT disorders also, and it can be given in the conditions of any avastha where Nasya is necessary, we can use it as Nasya. If we go through the reference, Bilwadi is mentioned as Bhujanga Lutonduru Vrashchita Dehi Visuchika Jirna Garajwaraishcha Artan Naran Bhuta Vidharshitamshcha Swasti Karoti Anjana Pananasyaihi. Anjana Pananasya is the mode of usage, and the clinical conditions are, it is applicable for 4 departments. In Ayurveda, 4 departments can extensively use this. Bhujangalutonduru Vrishtika Dehi is for a toxicologist who practices Vishachikitsa. It can be given in snake bite and other animate poison conditions. Visuchika, Ajirna, Gara, Jwara, Ishcha. It can be given in Visuchika, Ajirna, Gara, and Jwara. So we already discussed about Amavisha, Annavisha, Gara, and Jwara. I told yesterday that Jwara is an inevitable area where we have to search for Visha, Nidana. If we find any Nidana which is relevant to this clinical condition where the patient is in front of us, is one way or the other related to a toxicity, a toxicological, may it be ama or an external allergen, and the reactionary inflammatory pathology is going on in him, Bilwadi Gutika is the one which we can think of. That is because of Visuchika, Ajirna, Gara, Jwara, Ischa. And the third specialization, and this line, Visuchika, Ajirna, Gara, Jwara, Ischa is relevant for Kaya Chikitsa department. And the third line, Arthan Naran Bhuta Vidarshitamscha. Now this is relevant for Manasaroga specialist and Kaumara Bhritya specialization. Why Bhuta Vidarshitamscha? Because it can be given in the conditions of Graha, it can be given in the conditions of Unmada, in the form of Nasya as internally, or also for Talam. How can be given? Now next comes Anupana. In Visha, it can be given with Tulasi Swarasa. Tulasi Swarasa, external application as well as internal administration. And in the conditions of Visuchika, Jirna, Gara, Jwara, Ischa, we can give with Ardrata Swarasa or Jiraka Kashaya or any other Pachana Samyukta Kashaya, like Pachana Amrita Kashaya is one yoga. Amritadi or Pachana Amritam Kashayam is available in the market. For Ama Visha, we can use it. Ardraka Swarasa is very, very effective if Gara is suspected. It does an excellent Pachana in the condition. So that Annadigatasya Chilingani, we can prescribe it for Kaya Chikitsa, Ardraka and Jiraka. If we are expecting a Vata Anulomana or Vata predominant Kapha Samyukta condition, we can use Jiraka Jala or Jiraka Kashaya together with that only Jiraka, dry fried, and then Bilwadi Gutika can be prescribed. And what about the third line for Manasaroga and for Kaumara Bhritya? It is one of the best drug and commonly prescribed drug in the conditions of autism spectrum disorders. And for children also, Bilwadivati is very, very effective. There is one charitable OP, which I am going there 3 days a week. There for children, especially for facial palsy or global developmental disorders and for autism disorders, we admit the patient there, treat them with the proper necessary situation-based IP treatment, and throughout these conditions, we prescribe Bilwadi Gutika in a very regulatory dose. For example, half tablet 4 times a day, like that pattern. It acts as a wonderful drug in autism spectral disorders. The children will be that Bhuta Vidarshita, overactiveness, attention deficit syndrome. Such symptoms are well managed. And if the patient is having Kapha predominant avastha, we usually use it as a Nasya in Unmada, depressive disorders where Kapha is concerned and where Vamana is indicated. In such psychological, especially depression state disorders, we can use Bilwadi Gutika as Nasya also. That too in Churna Nasya or in the form of Swarasa Nasya. Swarasa Nasya, what we do is we powder Bilwadi Gutika, put the Tulasi Swarasa to that, make it a small potali and squeeze the potali to the nose in the form of Pratimarsha Nasya sort of. 1 or 2 drops will be enough in a day. That gives a wonderful result. That gives a very wonderful result in patients. So 4 areas with this single medicine we can practice. So if we think that Bilwadi Gutika is only effective in Atisara, actually we are limiting our area of usage of Bilwadi Gutika. It has a wider, this much areas we can prescribe in the condition of Jangama Visha or Ama Visha or psychiatry or Kaumara Bhritya specialization. And also Anupana. Anupana is very, very specific. Tulasi Swarasa, Ardraka Swarasa, Jiraka Swarasa, or sorry, Jiraka Kashaya or Jiraka Jala, we can prepare and give. Now, its application, if nothing is available, simple water at least will be sufficient, because there are many times where people will not be accessible to these things. Jiraka is very common. They won't say, yes, it is available. But Ardraka at times it will not be available in Shunti, will be available at house. Dried ginger will be there. Still, there are many times where I have advised to the patients, okay, prepare shunti jala. Shunti will be crushed in 2 or 3 glasses of water and keep that. Take Vilvadi Muhur dose. One more area is this recurrent mosquito bites. I showed 2 pictures of 2 children. If you remember the last 2 slides, that Kitavisha area. In those 2 children, Bilvadivati has been very handy for me. That too, half tablet 4 times a day, and with the Dashangam tablet, half tablet 4 times a day, and that has given wonderful result. In 4 days, such lesions can. Insect bite is very common. We can, except for snake bite, we can dare to manage all the other animate poison like Lutavisha, everything. So I will go on telling how we can use in Kitavisha, especially with the vesiculobullous lesions or any other clinical condition where there is vesiculobullous lesions are there, which has been of acute onset. And those clinical condition where I mentioned yesterday that Dushi Visha, Kota is one word mentioned in the context of Dushi Visha. If you remember, Dushi Visham, Tushonita Dushti, Aruhu, Kitibha, Kota Lingani, sudden onset of a urticarial rash. Bilvadivati and Dashangam combination acts wonderful because in one or the other way, a GIT manifestation or an external origin condition can be a possible factor for such sudden onset of rashes. So such conditions also Bilvadi together with Dashangam acts very fast. And also by advising proper patya, we can have a very desirable result. And in this reference, last ingredient is Bastamutra. Why Bastamutra is written? Because Bastamutra is a Vishagana Dravya. And one more word is mentioned in the reference. Susukshma Pishta is mentioned in it. In the reference, if we see Ashtanga Hridaya, Uttara Tantra, in the context of Vishachikitsa, Vilvadi Agada is mentioned. It is mentioned as Vilvadi Agada name. Tablet is available, or else we can prepare. Susukshma Pishta is theoretically and practically relevant because it is used as Anjana and Nasya. So the drug should be well powdered and well triturated, or else that the dry drug, if any fibrous portions are remaining, that can cause further eye allergy or nasal allergy. That is also one practical issue. Practical thing solved. At the same time, more the bhavana, more the efficacy. That is why Susukshma Pishta is mentioned. The more bhavana is given, the more efficacy for the drug. And there is one thing which my teacher practices. In one Kalva, Bilvadivati will always be there. Never ending process. Bilvadi Gutika should be directly taken from the Kalva, rolled into a tablet and given to the patient. This is a customary which is practiced by Vishachikitsa practitioners. Now, as it is practically not possible in our OP, we are preparing it once, prepare it, keep it after drying. But that is not the proper way of management. In one Kalva, there should be Bilvadi Agada. As far as we take the drugs, keep on adding the drugs, keep on grinding. That is the textual literature meaning of Susukshma Pishta. A never-ending stock of Bilvadi Gutika kept on grinding in the Kalva. So we should take and give directly to the patient from the Kalva. That is actually the most effective nature of prescribing Bilvadi Gutika. Right. Next is Visha Bilvadi Agada or Visha Bilvadi Gutika. This is from Kriya Kaumudi. There is another textbook of Vishachikitsa called Kriya Kaumudi. All the indications are similar to Bilvadi Gutika. Whatever for the past 10 minutes I have mentioned for Bilvadi Gutika is applicable for Visha Bilvadi Gutika. But it is more effective than Bilvadivati and fast acting than Bilvadivati. So whenever there is any case of snake bite, or if the ama is severe in nature, we can prescribe Bilvadi Gutika. Visha Bilvadi Gutika. The additional ingredients are Nilini Mula, Ishvara Mula, and Patha. Nilini Mula, Ishwara Mula, and Patha. Now, two more varied preparations are mentioned. They are one which is added with Ashwagandha, that is optional. Now, if we want to use Vishabilvadi Gutika in a Vata Kapaja case as a Rasayana, we can add Ashwagandha to that tablet and keep a different set of medicine. So Vishabilvadi prepared in 2 bottles, one with Ashwagandha, one without Ashwagandha. This is also an option. So in an acute condition, wherever we can give Vilvadi, if the situation demands much more faster action and much intense action, we can use Vishabilvadi Gutika. And one more, another version, another variation of Vishabilvadi Gutika is using Gorochana with it. Gorochana is not easily available, legal problem. So from a legally permissible person, if we get Gorochana, we can add Gorochana to it while grinding. Again, that theory of Susukshma Pishta still there. Theory of Anjana Pananasya is all there. All those Kaya Chikitsa, Agada Tantra, Psychiatry, Kaumara Bhritya, all are there. The indications are all applicable. But if we add Gorochana to this, respiratory distress can be managed far more better. One added indication is respiratory conditions can be. In Malayalam, it is told Shwasa Tadasam Nikum. That is, the respiratory distress can be cured, can be relieved. So, in the conditions of acute respiratory or bronchitis, or patient is gasping for breath during the episodes, we can think of prescribing Vishabilvadi Agada with the third variation of adding Gorochana to this preparation. And Gorochana is available. Only we have to get it from a certified shop, registered shop we can get. It is a little bit costly. I think per gram last time when it was procured, 4,000 per gram was there. Only we have to add a little bit in Gorochanadivati, or in this, what is done is, if all the drugs are taken 50 grams, the ingredients of Vilvadi or Vishabilvadi are taken 50 grams, not more than 5 grams are needed, or even 1 or 2 grams can be added, but depends upon our mindset, our concept. So what I have requested with my person who prepares medicine is adding 5 grams to 50, 1/10 of it. Now next, this is Jivaraksha Gutika. Jivaraksha Gutika is, the name itself suggests, it is the first line of medicine given for Jangama Visha. For a person who seeks Rasayana, Rasayana effect, Jivaraksha Gutika can be prescribed in 1 tablet per day with the milk early morning, 1 to 2 hours before breakfast. This is the indication. And now, please remember the cases of yesterday. Those cases of yesterday, one skin graft rejection case I had discussed. We had treated in the line of Mandale Vishwachikitsa. That road accident case, tibia fibula, multiple fracture, surgery done, skin graft failed in such non-healing ulcers. And also, if you remember that ulcer in the case of that teacher who had developed multiple ulcers on the lower limb with the maggots, Jivaraksha Gutika was the first drug which we had prescribed. And the third case was as a Rasayana. If you remember that pustular psoriasis, Lantopamar pustular psoriasis was there. That hands and foot which I had shown, I had prescribed Jivaraksha Gutika as a Rasayana. 1 tablet, and 1 tablet given in the early morning with the milk. Definitely it should be given only with the milk. Only with the milk. No other Anupana is prescribed. It has to be given with the milk. Textbook says so. So we have to use it with the milk. And there is a small variation in preparation actually. Here, The first two drugs are Vanga and Rasa. Vanga is available in solid form, and we have to mix Vanga and Parada to make a powder. What we have to do is keep all the mentioned drugs, Vanga, Rasa, Haratala, Manashila, Hingula, Tankana, Tutta. This condition is Vacha, Spatika, Bakulu, all the drugs should be kept in the right side. Quantity used is also mentioned. That specified grams should be there. This is one yoga. And proportionately we can increase. We can take 4 grams of Vanga, means if we take 400 grams of, this is actually from one yoga which is mentioned. Only limited tablets will be properly prepared. But if you want to increase it proportionately. But this proportion also should not be changed. This is the fixed proportion, standardized proportion, what the textbook has mentioned. And what we have to do is, Vanga should be liquefied first. It should be heated. And that Kalva Yantra should be kept very near to that gas stove. We have to liquefy Vanga and pour it to the vessel in which Rasa is kept, Parada is kept, and immediately start grinding, so that Vanga will not solidify and it gets mixed with the Rasa. Now we will get an dark ash colored powder. Triturate it very well. We have to triturate it for half an hour. We will get a very fine powder. And once it is properly mixed, go on adding one after the other the mentioned drugs. Then add Haratala Churna, then add Manashila Churna, then add Tankana Churna, and keep on mixing. Once till Patha is added, we will get a very good fine mixture of a powder in our Kalva. So now comes the question whether we have to do Shodhana for this or not. Here also we have to do Shodhana for all these things. If we are not intending to manage Sarpavisha, Shodhana has to be done. If Sarpavisha also coming to our purview, we should not do Shodhana. So with my teacher, whom I had gone to learn practicing Vishachikitsa, he has 2 bottles of Jivaraksha Gutika. One for a non-toxic case, which can be given in a lesser toxic clinical condition, and another bottle Jivaraksha will be given for only Sarpavisha cases. And that too not more than 6 tablets for 2 days. That much precaution has to be taken. So in our clinics, better to keep a properly Shodhita Rasaushadhi Yukta prepared Jivaraksha Gutika, because not intending to practice Sarpavisha. So in such extreme cases, in a case of non-healing ulcer, in a case of diabetic ulcer, in a case of neurogenic ulcer, in a case of diabetic non-healing clinical condition where there is peripheral neuropathy sort of conditions, in the case of such road traffic accident, for all those conditions, first line of management we can depend upon this Jivaraksha Gutika. But the dose, properly Shodhita dose also, 1 OD per day, 1 tablet once daily with the milk. If the condition demands, if for example that teacher who had maggots and multiple ulcers on her lower limb, I had prescribed 1 tablet twice daily, 1 tablet twice daily for 1 week. After 1 week, the drugs withdrawn, because by then the maggots and ulceration had gone. Now my requirement was to manage her other clinical condition. So what we can do is, am I audible?
Yes, sir. Yes.
Okay. So 1 tablet twice daily we can prescribe, and the Bhavana Dravya is, in this is Arka Kshira is mentioned, Calotropis gigantea, latex is used, Kshira is used, but procurement is difficult. practically the procurement is difficult. When we bring a Kshira from the place of collection to our OP or to our preparation room, that will get dried. So we had tried several times during our post-graduation days to collect Arka Kshira, but it was very, very difficult to get it daily to that extent. So Arka Patra Swarasa is an option. Arka Patra Swarasa usage is equally effective clinically. So the preparation today, which I am using in my OP, is from Arka Patra Swarasa. Bhavana is given for a day, morning to evening. We have to give bhavana to it, and it should be prepared. It should be prepared into a tablet with one kola pramana, badara bija pramana, one badara bija pramana, and that tablet has to be dried in shade. It should not be exposed to sunlight. In sunlight, direct sunlight should not dry this tablet because it will get a sticky nature. So it's always advisable to dry in a shade. And probably 3 to 4 days are required to get dried. So this tablet is effective in all those clinical conditions. As a Rasayana, I told as a Vyadhi Prathanika and first line of treatment for Sarpavision. This is all about Jiva Raksha Gutika. The method of preparation also, I think you have understood. Next tablet is Taruna Bhaskara Gutika. Now, again, I will go to previous slide. The name of this yoga is Taruna Bhaskara Gutika. The first one we discussed was Jiva Raksha Gutika. The name itself suggests its indication. One gives Rakshana to the Jiva, and other gives a life. For example, the second line, just like Udaya Surya, the sun is rising, Bhaskara is Taruna, it will make a person Taruna at the same time, just like Udaya Surya. Once Jiva is properly protected, to give a proper Rasayana backup, Taruna Bhaskara is given. In Sarpavisha, once that Jiva Raksha prescribing phase is over, the patient is safe from the snake venom toxicity. Stop Jiva Raksha, start prescribing Taruna Bhaskara tablet. This is what we do in snake bites. Now, what are all the clinical conditions we can use Taruna Bhaskara? We can use in the case of Dushi Visha, especially as well as Rasayana. In Vata Rakta diagnosing cases, Vata Rakta is a very huge area. Even a case with the raised uric acid level or raised RA factor level, raised ASO titer level is also Vata Rakta, but raised HLA-B27, ankylosing spondylosis, multiple sclerosis, or a case of progressive neurological condition can all be brought under the shade of Vata Rakta spectrum, because in the Vata Rakta Samprapti we get one word, Raktena Avaritaha Patihi. In this Raktena Avaritaha Patihi or Daru Haridra, and all the ingredients, if you see, many are
Sir, there is lot of voice disturbance, sir.
nature, and many are Rasayana in nature. So this is what had a few cases of psoriasis, which was, that is because the network in house is off. Am I audible?
Yes,
Am
sir,
I
but
audible?
there is lot of network issues.
Is it getting disturbed?
Yes, sir.
Am I audible?
Yes, sir.
Now?
No, sir.
Am I audible now? Are the slides visible?
A slide is visible, sir.
Okay.
Yes, sir, you're audible.
That is because the major issue is from yesterday. I have been quarantined. There was one,
Oh.
so I cannot go to the college without any. I am sitting alone in a room which is very near. My house is near to the main road. That's why every vehicle running honks when it comes near our home because it's a small junction. Kindly excuse because of such unavoidable
No problem,
situation.
sir.
I am.
No
I have
problem, no
been-
problem.
Yes, tied down at house. Okay, continuing with that, Taruna Bhaskara Gutika. In the cases of psoriatic arthropathy, in the conditions of psoriatic arthropathy, once the initial avarana is broken by the help of the drugs, which I won't suggest any medicines. In the condition where there is Raktena Avaritaha Patihi factor is there and Kapha predominant Kaphadika Vatarakta is there. Once that Avarana is broken, Marga Avarana is broken, straight away we can prescribe Taruna Bhaskara Gutika. No need to do Shodhana. No need to do Shodhana. We can prescribe Taruna Bhaskara Gutika. In many cases, in OP management, once that Kaphavarana is broken, one BD of Taruna Bhaskara Gutika can be given for a duration of 1 month because it is not as toxic as Jivaraksha Gutika. The ingredients are comparatively safer. No problem that we can give. Now, one drug, I forgot to tell, one drug in Jivaraksha Gutika, was Kattu Chanakam. Its collection is little bit difficult. Kattu Chanakam means we have to wait for it. The newly born calf, its defecation, its fecal matter, that too first fecal matter. The newly born calf, its first defecating content is called Kattu Chanakam, and it will be yellowish in color, golden yellow in color, and we have to mix it with water because a little bit of hairs will be there in it. Hairs will be present in it. That has to be and flow. We will get a liquid. It can be dried and then later put to the tablet. Kattu Chanakam is the first fecal matter, void fecal matter of the newly born calf. And there are other ingredients which I am not using. The same principle. First fecal matter of newly born can be used. The yoga is fecal matter is used. The yoga is different. And in elephants, the first newly born infant elephants, fecal matter, first fecal matter is used. But in Jivaraksha Gutika, it is calf. Right. And coming to Taruna Bhaskara Gutika, there is another word called Garuda Pacha. You saw that Garuda Pacha is a word mentioned in it. This is Selaginella. It is available, but in North Indian drug market, Selaginella is available. Selaginella is available. That is a bit difficult to get, but I am getting it from North Indian market. And these are the indications of Taruna Bhaskara Gutika. And there are 3 cases of multiple sclerosis which are constantly coming for admission, taking treatment for 2 weeks, and for Rasayana purpose they are taking Taruna Bhaskaram Gutika for the past 2 years. And by the influence of Taruna Bhaskara Gutika, the bedridden, all those 3 patients have started driving now. Now may it be the effect of Taruna Bhaskara, may it be the effect of admission once in a year. They are having all treatments of Vata Vyadhi now, and as a Rasayana, Taruna Bhaskara Gutika with the Brahmi Drakshadi Kashaya. Brahmi Drakshadi Kashaya is mentioned in Sahasra Yoga in Jwara Prakarana. For those who can follow Hindi, who can follow Malayalam, Sahasra Yoga is available in Kannada as well as Hindi. For Hindi, we are having CCRI's publication is there. It's a very good book, elaborately mentioned in Hindi. So in that also, Brahmi Drakshadi Kashaya is mentioned in Jwara Prakarana. That Kashaya is good in Jirna Jwara, Purana Jwara. In such condition, once that Jwara is very Purana, next we have to manage Vata. So such Vata Vyadhi is also Taruna Bhaskara Gutika is effective. So in a chronic condition where we need a Rasayana, where is Dhatukshaya in the Avastha, and it can be prescribed in such Gambhira Vatarakta sort of old clinical condition, Purana condition, we can prescribe Taruna Bhaskara Gutika. Such neurodegenerative conditions, we can use Taruna Bhaskara Gutika. Next comes Pavitra Vataka. Pavitra Vatakam is a Shodhananga Dravya. It is prescribed in the clinical condition where we need Vamana, at the same time we need Vishaharatva. So for routine clinical practice, Pavitra Vatakam may not come into action, but at times we need Vamana. Immediately we need Vamana. In such clinical condition, we can give Pavitra Vatakam where toxicity involvement is there. It is prescribed in Sarpavisha where once Snehapana is given. I told Snehapana in the line of Hridaya Varana for a Shodhananga Snehapana. In snake bite cases, there is a habit of giving half a liter to 1 liter of Grita to a patient. Continuously, he has to take that 1 liter of Grita. Just for the sake of protecting Ojas, it's a practice that as soon as the snake bite occurs, if the person calls the doctor first advises to drink Grita as much as possible. Once he comes to the clinic, he is given Pavitra Vataka, and that Pavitra Vatakam induces vomiting. There is a concept that Hridaya Varana done patient, there will be upachaya of Sneha. Sneha Hridi upachiyate. For that, Vamana is to be done to remove that Hridi upachita shleshma. That theory is brought into practical by giving Snehapana to the maximum quantity, giving Vamana as soon as he comes to the clinic with the Pavitra Vataka. And the clinical condition that probably we can give is in Jwara, where Ama related Jwara is there, and we need to give Vamana. The indications are Tatra Utkrishte, Samutklishte, Kapapraye, Chalemale. This is from Jwara Chikitsa. In such Utkrishta Avastha of Kapha, we can give Pavitra Vataka. At the same time, Vamana will also occur. At the same time, Ama will also get rectified. So in this two area of actions, Pavitra Vatakam is given. And the drug are also, I have mentioned, no different pattern of preparation of medicine is there. It can be prepared. Next is Morwadi. My most used drug in OP, Morwadi Agada. The ingredients are mentioned. Its indication is very, very worth noting. No indication is mentioned. Only Garopahata Pavakaha is the indication. So I already told yesterday that there is no diagnosis called Gara. There are only diagnoses which occur due to Gara. The clinical conditions which occur due to Gara. So Gara Upahata Pavakaha. In a clinical condition, I will quote one example of Budd-Chiari syndrome, which the photo I had shown with the video of that adult person. That clinical condition where Budd-Chiari syndrome was diagnosed, he had hepatosplenomegaly, he had marginal ascites, he had esophageal varices, his bilirubin level was more than 10, his HB level was less than 10, he had icterus, he had a very huge amount of ama in him because he had no appetite at all. In such condition, Morwadi is effective. And also, in the clinical condition where we suspect Amavata, due to Upachita Shleshma. Prathama dosha dushti samprapti is concerned. Prathama dosha dushtimcha. In the ama, if we see Rasagata ama, ama vata, in the conditions where there is sama associated with vata, these conditions, if Gambhira Dhatu is involved, we need a much penetrating amavastha, more than Agni Tundi Rasa, more than Chitrakadivati, more than Shunti Churna, more than Panchakolasava, Morvadi can be opted. The dose is 5 grams twice daily, and invariably Takra has to be used. Takra is the Anupana for this Morvadi Agada. All the drugs are easily available. Chitraka should be Shodhita, and we can use this drug, Morvadi Churna. Appetite increases like anything. Very good Amanirharana drug. So every time such systemic involved Garavisha case comes to our OP or IP, prescribe Morvadi for Deepana Pachana purpose. Once Pachana is attained, further treatment will be planned. So Morvadi can be prepared, Churna, not so costly, we can use. And in OP, tablets are prepared. In OP, Morvadi tablet is prepared, and tablet is prepared with the same Churna Kashaya. This Churna Kashaya is prepared, and the same Churna for powder. Bhavana will be given for a day, and then tablet will be prepared. This is the we are using in our OP, because Churna shelf life period is a little bit lesser. So because of more moisture humidity problem, tablet is prepared. For much needed cases, I get it from my teacher. Morvadi Churna is there. He prepares Churna, and for the few months, Churna is being prescribed in 1 teaspoon, twice daily dose with the Takra. That is most important. Those who are not having Takra cannot get Takra. Hot water can be advised, but better to give it the Takra. In all Gara condition, we theoretically described all the areas of Gara, right? One example I mentioned, Morvadi for Budd-Chiari syndrome. All the other cases, whichever theory we have mentioned, Gara in the case of Annadigatasya Chalingani, Gara in the line of recurrent manifestations which have already reached into the circle of Dushi Visha, Morvadi can be prescribed as an Amapachana, because Acharya has not at all limited its indication. Gara, Upahata, Pavakaha. And Gara is not a diagnosis. Gara is the condition which leads to a diagnosis. Next, Dushi Vishari Agada. Dushi Vishari Agada also. We discussed yesterday regarding the treatment principle of Dushi Visha, right? The clinical conditions we discussed. The Dushi Visha condition, how to manage, I told. The similarity of treatment in between Viruddha, Dushi and Gara, I told. After Shodhana, the shloka goes in this way. Dushi Visharto Suswinnam Urdam Chadasya Shodhitam Dushi Visharim Agadam Lehayet Madhuna Plutam Dushi Visharim Agadam Lehayet Madhuna Plutam. Once Shodhana is done, then prescribe Dushi Visha. Dushi Vishari Gutika. So this Dushi Vishari Gutika should be given with Madhu. Should be given with Madhu. If you see the indications of Madhu, the first 2 lines are very, very important. Ashtanga Hridaya Sutrasthana. While mentioning about in Dravadravya Adhyaya, it is mentioned as Chakshushyam, Chedi, Trit, Shleshma, Visha, Hidma, Asra, Pittanut. So Visha is there, Asra, Pitta is there, Chedi Guna is there. So I need not explain it more. What speed, what reachability Madhu can give to Dushi Vishari Agada if it is given with Madhu. Such an effective drug. Once Shodhana is done, we can give Dushi Vishari Agada, where all the theoretical aspects of Dushi Vishari yesterday mentioned are brought into the picture. Recurrent clinical conditions, we have to give Dushi Visharim Agadam Lehayet Madhuna Plutam. The ingredients are there. It is not much a difficult yoga to prepare. We can use Churna or tablet. Churna is better actually. Always this Morvadi and Dushi Vishari. Churna, if we are able to keep it with us, that is more than enough. Now for Lehayet Madhuna Plutam, or with the takra, every indication will be satisfied if we prepare it in a order form. Next is Dashangam Gutika. I mentioned in 2 or 3 conditions where that sudden onset of a skin lesion, sudden onset of a papillobullous lesion, or urticarial sort of presentation, or in the condition where pitta is very much aggravated, Dashanga Agada or Dashangam Gutika can be given. I have written it in Dashangam Gutika because Gutika is available. I am not preparing it, but getting from outside. Bilvadi and Dashangam go hand in hand many times in such Annadigatasya cha lingani or any Ashayapakarsha Samyukta Samprapti is suspected. Ashayapakarsha is mentioned in Charaka Sutrasthana 17th chapter, where he mentions the Samprapti of Kamala. We usually use Ashayapakarsha for Kamala, but not always. Not always. Kamala is only one of the indications. When we interpret the textbook, that 17th chapter and all the clinical conditions mentioned, are very, very relevant. They can be fixed to any of the clinical conditions which are having an ongoing samprapti in it. That is the relevance of that chapter. In Charaka Sutrasthana 17th chapter, we get almost all the permutation and combination of doshas, right? Vata normal, pitta more, kapha less, vata less, pitta more, kapha normal, vata. Such permutation and combination, the clinical conditions are mentioned. What are all the symptoms elicited in the patient? They are actually an ongoing process of a disease. A case which we have already named it in our BAMS syllabus as Ashayapakarsha, the patient can land in Kamala, but he can also land in Visarpa. He can also land in Udarda, Shita, Pitta, Kotha, because Vata predominant, Pitta normal condition, the Vata drags the Pitta to all over the body, causing Bheda Daha. Right. The clinical condition is so characteristic that Tada Bhedascha Dahascha Tatra Tatra Anavasthitaha Gatra Deshe Bhavatyasya Shramo Daurbalyamevacha. Shrama Daurbalya is because of Vata, but Bhedascha Dahascha, the pain will be excruciating. There will be burning sensation all over the body. These are all premonitory symptoms of an urticaria. These are all premonitory symptoms of a pitta has dislodged. That hint is given. In such conditions, Dashanga works very well together with Dashaimani. Now I am introducing a new area called Dashaimani in Charaka Sutrasthana. Dashaimani are group of 10 drugs. I need not tell what they are. Let us go on discussing. In that area, Dashangam fits because no diagnosis has happened. The disease is in an ongoing process, and we need to catch the Vata or Pitta or the symptoms caused by those dislodged doshas from its normal site. In such clinical conditions, I will not govern the medicine. I repeat, I am not a person who has to govern medicine or form a prescription. I am against that. I will tell the clinical condition and the rest is left to the physician and that clinical condition. Okay. In such Bhedashtadahashcha avastha, which clinical condition is not relevant here. For that, am I audible?
Yes, sir. Much audible.
Yes, sir.
In such clinical conditions, Dashanga Gada holds good. Now, remember that foot of that 8-year-old girl with multiple rashes of mosquito bite. It has not gone into an eczematous stage. It has not got any T cell proliferation in the body. Antigen antibody response has just started. And remember that foot of that small boy with vesiculobullous lesion, where the histamine release is already there and it has not formed any ulceration or not formed any gross lesion over the body. That flight mechanism of T lymphocyte pathology or antigen antibody reflex is in the process. Dashanga Gutika is effective. I need not explain more, I think. Next slide. Hingwadi Gutika. This is children's Jivaraksha Gutika. Jivaraksha Gutika for a child. All the indications are mentioned in Jivaraksha, and this is for a child. No toxic ingredient is there. Only Arkakshira is there. Instead of that, Arkapatra Swarasa is used for Bhavana. Tablet is prepared and it can be given. Neeli Tulasyadi Kashaya. This was the one I had mentioned in the first area, where Neeli Tulasyadi Kashaya, Taila, everything is there. We can prescribe it in the conditions of Vata predominant condition mimicking herpes zoster, herpes simplex virus, or in the conditions of post-herpetic neuralgia. Neeli Tulasyadi comes into action together with Gopi Chandanadivati. Now, herpes zoster, herpes simplex, or post-herpetic neuralgia, if we are suspecting Vata predominance in it, Kapha is in Samsrashtavastha and the lesion is gradually spreading, all these symptoms are mimicking Lutavisha. If you remember those two Lutavisha cases, one of that lady who had a lesion on the neck, on the head, and on the ears and the post-auricular area, pustules with oozing, Neeli Tulasyadi was an inevitable drug there. And we had prescribed Neeli Tulasyadi together with Jivaraksha Gutika. Once Jivaraksha Gutika had done its action by drying up the lesion, we had shifted our gears to Taruna Bhaskara Gutika and Vishavilvadi Agada. Once that area was crossed, Neeli Tulasyadi was the only thing which was later followed. So this is the pattern of using in a clinical condition. Neeli Tulasyadi indication in such Lutavisha sort of presentation, we can use it. We can use it in Vatarakta also. We can use it in Vatarakta also, where there is ulcer involvement. Neeli Tulasyadi Kashaya. Grita in the cases of Ashayapakarsha again. Vata is in aggravated phase, Pitta is in normal phase, and Kapha is in normal phase. It is dragging out the Pitta, and Tada Bhedascha Dahascha Tatra Tatranavastitaha Bheda Lakshana, if there, in a case of cellulitis, pain is only remaining in that case, we can use Grita externally also. We can use Grita internally also. I hope I have told the probable clinical condition what Neeli Tulasyadi can be, where Neeli Tulasyadi can be used. This is Gopi Chandanadi Gutika. This much ingredients are there, and these are the ingredients. Mentioned in Visarva and Jwara. Visarva and Jwara. Can I take a minute, take 1 minute break?
Sure, sir. Sure, definitely.
Yeah. Am I audible?
Yes, sir. Yes.
Am I audible? Water and then continue.
Yes, you are audible, sir.
Yes. Shall we continue? Shall we
Sure.
continue?
Sure. Sure.
Yes. I went to take water.
No issues.
Okay. Now this yoga is specifically indicated in Visarpa and Jwara, that too in Vata Pitta origin condition. If we see Charaka Samhita, a little bit of theory again, if you don't mind. If we see Charaka Samhita, we cannot see in detail regarding the management of Vata, the management of Pitta, and management of Kapha separately. Maybe it was the oldest of the textbooks available. An order has not been maintained in that, but we have to refer from one chapter to the other. Just like in 23rd chapter, Annadigata mentioned, run to Vimanasthana. From that Vimanasthana, run to Charaka Sutrasthana 24. From there, run to Dhatu Pradoshrikar. This, unfortunately, this is the pattern. But if we follow that pattern, a lot of things mentioned in Charaka can be deciphered. Just like that 16th chapter, Shodhanarha, we discussed yesterday. Those shloka had 8 factors in them, 7 dhatus and ojas in them. And similarly, this Jwara, Prameha, Vatavyadi are Murti Bhava of Pitta, Kapha and Vata respectively. Jwara for Pitta, Prameha for Kapha, Vatavyadi for Vata. And 3 subsidiary chapters are also mentioned. They are Vatarakta, Visarpa and Kushta. They are secondary to Jwara, Prameha and Vatavyadi. Vatavyadi and Vatarakta are for Vata. Prameha and Kushta are for Kapha. Jwara and Visarpa for Pitta. And striking similarity we can understand is, whatever general principles in Ayurveda management are mentioned, they are all seen in that chapter. In other words, the treatment principles mentioned in these 6 chapters are applicable to all the clinical conditions that come to our OP or IP, as far as Charaka Samhita is concerned, or else there is no way to understand the beautifully explained doshas in Charaka. Many tell it is outdated, but it is actually advanced. We are not in a position to understand where to fix that case. We know Kavi, what to say, had a habit of complicating the things while presenting. That shows their intellect. The period was like that. If we read the older Kavi textbooks in Sanskrita, they will juggle with words. It's their pleasure actually. They had time for recreation by creating poems in a beautiful way. Charaka was one such book. If you see Ashtanga Hridaya, it is more poetic. These were all written actually to show how intelligent they were, and they were thorough with the grammar as well as they were intellect. But unfortunately, we are not in a position to follow that. We are not having that much intellect. But we will continue. I think I am going to out of the topic. This Gopi Chandanadi Gotika is Vata Pitta Hara in nature, and also it is Kleda Shoshana as far as Pitta is concerned. Kleda Shoshana is in Pitta. Pitta is in nature. So in the Visarpa, in Kushta, if we suspect majority in Visarpa, if we suspect Kleda, we can use Gopi Chandanadi Gotika. And why Karanja Patra is always associated? Because Karanja is Vishahara in nature, Kapahara in nature, Kleda Shoshana in nature. So Karanja Patra adds its potency with the Gopi Chandanadi Gotika. This is why in my OP this is used to the maximum, especially in the case of viral infections, where there is tonsillitis, where there is where MRI or some USC lymphoma or whatever clinical condition are there. In such nodular swelling where pitta and cleda condition, Gopichandana Vibhutika can be given with the Karanjapatra Swarasa and Nili Tulasi Adi Kashaya. I need not tell more, I think. Next is Kosha, a very wonderful drug. Very wonderful drug. Again, just like Murvadi, here also no indication is mentioned. No indication, but mentioned in Vishachikitsa. Kosha Takyadi Yavagu is the preparation. We prepare Yavagu in this pattern. The drugs are collected, Kashaya is prepared, and rice is baked in this Kashaya. Kosha Takyadi, ingredient Kashaya is prepared, and in this Kashaya, rice is that he mentions indication is Yunjat Vegantare. He didn't tell Yunjat Visha Vegantare. If we are only satisfied by reading that chapter, Vishachikitsa, Samanya Vishachikitsa in Ashtanga Hridaya Uttaratantra 35th chapter, okay, fine, we will use in Vegantara, we will use in Sarpavisha only. But if we go deeper into the textbook, Vega is mentioned in many other chapters also. Example is Jwara, Antarvega Jwara, Bahirvega Jwara, and they are coming under Vega classification of disorder. Again, Vega is mentioned in Unmada and Apasmara. Vega is mentioned in Ardita. Vega is mentioned in Bahirayama. All these disorders in Kushta also, there is waxing and waning and relapsing sort of features. And worth noting is all these disease disorders, Vega is mentioned, and Vega is also mentioned in Vamana and Virechana as far as the treatment area is concerned. For Vamana, we Vegas, so that the patient should not be dehydrated, so that the patient should not go for toxic condition, so that for dehydrating situation in which can get exacerbated in specific situations, Kosha Takyadi Yavagu can be advised as an experimental basis. Together with my colleagues of Panchakarma department, we had tried with the Kosha Takyadi Yavagu in Vamana and Virechana cases. The patient were more comfortable and the result was encouraging. And in charitable hospital, this Kosha Takyadi Kashaya was given, because Yavagu is very difficult to get there. Kashaya was given in Apasmara patients where we had got results. So these areas where Vega is mentioned, so Vega, not only Visha, 4 or 5 clinical conditions I told, which can come in episodes. Kosha Takyadi Yavagu is there. As it is Vishahara in nature, we can use it in the conditions for sure, because result will be faster. Next, Dashaimani, I told. Dashaimani are a group of drugs which are which have no indications in the form of disease, but the first hand of prescription. They are casualty group of medicines. So 17th chapter and Dashaimani can be clubbed together. The 17th chapter of Charaka Samhita and the chapter where the Dashaimani is mentioned can be read together. This is first. Vishagnani is mentioned. What Visha we don't know. The patient is coming with sudden onset of a skin disorder or pain or swelling or Shota or Visarpa, and we are running out of idea what is happening in the patient, we can write this group of drugs. Visharganani. If Kandu is there and any insect bite is there or any Luta Visha is there, this Kandu Gnani comes into action if Pitta is proliferating, is predominantly seen in the condition. So Dashemani and that area is very, very effective in managing the toxic clinical conditions and sudden exacerbating features. These are Varnya, Daha Prashamana and Udarda Prashamana. Next is Shara Prayoga. We use Shara Prayoga only externally many times, but in acute clinical condition, Shara is very effective. This reference is from Sushruta. Indication. First indication is, if you see, if you see, the first indication is Gara, Gadaka. Now you remember Annadi Lingani and the Lakshanas of Gara. Gulma is there, Udara is there, Agnisanga is there, Ajirana is there, Arochaka is there, Arshas is there. All these things. And if you see Krimi, Visha, Arshaha, see all the indications of Gara is mentioned for Pani Akshara. And Shloka, this country there lies the relevance of Sharagada. Sharagada is mentioned in Gulma Chitsa, Vishachikitsa, Kapasthanagada Ama. In the conditions of Ajirna, a patient having zero appetite, a patient having to, we need to do a Tishna Aushadhi in that. But that Vishatva is not available, not allowing us to prescribe a Tishna Aushadhi. In such a situation where we suspect Ama, Sharagada is an excellent indication drug. You see the indication that Sarva Visha, Shota Gulma. In the condition where we suspect Visha, and there is Shota, there is Gulma, there is Dosha, Arsha, Bhagandara, all these clinical conditions, Visha is mentioned in Visha. Sarva Visha, Shota, Gulma, Dosha. All the conditions which are mentioned, if you suspect Visha as a Nidana and Kapha is there, you need to reduce that Kapha. This is the drug. Pandu is there, but mentioned last. Pandu Gadan. The next indication, Tapyadiloha. The area changes. See how beautifully the indications are same. Sarva Visha, Shota, Gulma, Twagdosha, Arsha, Bhagandhara, Pliha. Tapyadiloha. Both these have same indication. Panduroga, Visha, Kasa, Yakshma, Vishamajvara, Pushta, Hajaraka, Meha, Shopa, Shwasa, Arochaka. Visheshat, Hanti, Apasmaram. All these are indications similar. But in first together with that, Visha is mentioned, which means a patient presented with Ama, the reason is Visha in him, instead of Sharagada, give Tapyatiloha. Visha, Panduroga. Jwara, Visha, Panduroga. Now, dengue fever, a presentation of pyrexia of unknown origin. The indication, if you see, Panduroga, dengue fever, Pandu, Shamajvara, Shobha, or these features, if you see dengue, again, yesterday's message, we should be able to pick out the Lakshana from these gross indications of a medicine and form a formulation and form a proper samprapti and think of whether this yoga is effective in our case. Our case, who is in front of the Visha. Visha is not Sarpa Visha. Only Sarpa Visha, if we consider, again we are going to fail. In such condition, Jwara, Visha, Shwasa, Pandu, Pushta, the manifestation. See, and how can we use in the case of Visha and Meha? Where there is Prameha, Atyanta Upachita Shleshma, Ama is there, and the patient is Pandu. In such cases. Now the cluster formed is different. Thus, I have circled other clinical condition, Tapia, and another cluster I will tell now. Pandu, Kasa, Shwasa, Yakshma. In a case where we are suspecting Dhatu Kshaya in him, where we are presenting, the patient is presenting with the Rakta Kshaya, he is having Yakshma, a Vyadhi Sankara sort of presentation, Dhatu Kshinavastha, because of Pandu. You can see a very low hemoglobin presented patient who is gasping for breath. He cannot climb the stairs. Their Shwasa is not asthma. Shwasa is Krichrena Shwasati. Difficult for breathing. He is having exertional dyspnea, not bronchial asthma or bronchitis. The Shwasa mentioned with the Pandu is different. The Shwasa, who is having a Visha element in him, who is having Shwasa, think of Tapya Loha. Even though the chapter is mentioned there is Pandu, Visha is there, the Nidana is there. This is how a yoga should be interpreted. It is mentioned in Charaka. This is the yoga from Charaka Samhita, Pandu. Again, Asanadi Gana, Ashtanga Hridaya. Here also, Asanadir Vijayate, Shvitra Pushtakapa, Krimin. I won't go to the detail. If you see the textbook, Krimi is written in two ways. Krimi is written in two ways. One is Krimi, Kr, Rakara. Another is Krimi, Rakara. There is a gross difference in Samprapti. When we read Krimi in Rakara and Krimi in Rakara, that we can take in some other juncture or we will discuss in a later discussion. But here, Shvitra Kushta Kapa Krimin, Pandurogam Pramehancha, Medo Dosha Nibarhana. Now, our area of interest is Medo Dosha Nibarhana. Medo Dosha is managing in that condition, but the patient is brought to us with Panduroga. There are a lot of cases where Grahani is suspected and obesity is suspected. At the same time, the patient is having Upachita Medavastha in him. Because of that, he is having a lot of complications regarding GIT. In such condition, where Kapha is there, we can think of Asanadigana. We can get Pachana in that line. Kalyana Kagrata, I already told. Visha is there. We already discussed it while discussing about Hridaya Varna. Here, Pandu, I have circled that Visha word just because during the class hours it is required. So marked only Visha. For today's area of interest, together with Visha, Kandu, Pandu, Maya is mentioned, with Unmada is mentioned, and strikingly Unmada and Visha mentioned together. Charaka, Chikitsasthana, 9th chapter, 4th shloka, Nidana of Unmada. Unmada and Visha mentioned together. Abhayarishta, we all give for hemorrhoids, but unfortunately it is a Rasayana. And Rasayana in Gara. Grahani Pandu Putroga Vilha Gulmodarapaha Pushta Shopa Ruchiharo Balavarnagni Vardhanaha in the case of Gara. So for a patient who is diagnosed with Gara, who is not having any Pitta predominance and GIT irritation and Kapha is predominance in him, we can prescribe Abhayarishta for a long duration, for a very long duration, till his GIT is perfectly okay. See, Balavarnagni, it's a Rasayana, not a piles medicine. Many times our interpretation while reading the shloka can change our prescription. Balavarnagni Vardhanaha means it's a rasayana for whom? Grahani, Pandu, Pradroga, Pliha as an individual disorder, or for a cluster of disorders which is mentioned in these two lines, and these two lines mentioned in Arsha Chikitsa Abhayarishta is very similar to Garavisha Lakshana mentioned in Chikitsa Sana 23rd chapter in Charaka. See, the similarity, the interpretation of textbook is in this way. And the nowhere Visha is mentioned here. Grahani, Pandu, Droga, Pliha, Gulma, all these are mentioned. But here it is mentioned for specifically as a Rasayana purpose, and Bala, Varna are all lost in the case of Garavisha. The patient will have Ojas affected in him. In such indication, Abhayarishta should not be forgot. Yoga Raja Churna, again mentioned in Pandu, Rasayana Midam Shreshtam. Once Gara is cured, if the patient is unfit for Abhayarishta, Arishta Kalpana, think of Yoga Raja Churna mentioned in Pandu. Again, Rasayana Midam Shreshtam Sarva Rogaharam Shivam. Sarva Rogaharam Shivam. Pandu Rogam Visham Kasam. A case who needs Rasayana, who needs Rasayana, who has a Visha element in his Pandu Roga, Yoga Raja Churna can be prescribed. Here also, Budajani, Kamala, Visheshat Hantya Pasmaram, all these indications come to our OP, but we should keep one thing in our mind, that a disease name can be a disease presentation as such. It can be a nidana. It for another disease. It can be a lakshana of another disease, or it can be a complication of a disease which has already been running in that patient. If we think of Pandu, if we think of Kasa, Kasa can be a lakshana of a disease. Kasa can be a diagnosis as such, or Kasa can be a complication because of some other pre-existing illness. That's why history taking is very important. So as decision of medicine. Here, this symptomatology or symptom complex needs a Rasayana, means think of Yoga Raja Churna. Instead of thinking Kalyanaka Grita, where Kalyanaka Grita, the area is different, where we need a Tikshna Aushadha. But Yoga Raja Churna, it is written in Pandu. Once the patient needs a Rasayana, you can give Yoga Raja Churna. Together, this Yoga Churna and Kautaja Triple are mentioned together. See the Yoga Raja Churna, Kautaja Tripala, Nimba Patola. Kautaja Tripala is available. Kautaja Tripala is available in the market. Pandu, Kushta, the indication I will not repeat it again, but see the last word. Sarva Roga Haraha Shivaha. Sarva Roga Haraha Shivaha. You see the previous word. Rasayana Vidam Shreshtam, Sarva Roga Haram Shivam. Even the author was very pertinent in deciding to whom it should be given. To whom it should be given. Sarva Roga Haram Shivam, Yoga Raja Churna, and Kautaja Tripala, Sarva Roga Haraha Shivaha, Pandu Roga Kushta, and these are mentioned as two immediate shlokas. Both yogas are available. We can keep it in our clinic. Shelf life period is also good. And indication are similar, but to whom we should give, that is the trademark of these two changes in the lines. Sarvaroga Haram Shivam for Yoga Raja Churna, Haraha Shivaha for Shilajatu Pataka or Kautaja Tripla. Both are Rasayana. Yesterday I told already. Amukura Vaimbari. This is another yoga which is Vata Kapahara in nature, best given as a Rasayana in the case of Vata Rakta. In the case of Vata Rakta. This is Musta Ramachadi Kash. All the ingredients are there. Here, this is effective in the conditions of psoriasis where the patient is psychologically down. He is stressed. We have tried with Musta Ramachari Kashayam for depressed patient because of psoriasis, or both are going hand in hand together, because in this yoga and in any yoga, if Sarpagandha and Ishwaramula and Ashwagandha are mentioned together. Sarpagandha, Ishwaramula, Ashwagandha. Leave Ashwagandha, Sarpagandha and Ishwaramula are mentioned. It has something to do with Unmada and Visha. That is what the yoga gives us a message. If Ishwaramula and Sarpagandha are together in yoga, it is effective in Vishayukta, Vishasampati, Unmada presentation cases. For psoriasis with stress, or for stress with Vata, Kapha predominant clinical condition, we can use Mustaramachari Kashaya. Kottam Tagradi Kashayam. This is another yoga. All these are from Prayoga Samuchayam. This the textbook mentioned for this is Prayoga Samuchayam indication. No other textbook is followed. All these Mustaramachari, Amukaravayambadi, all these are from Prayoga Samuchayam. Kottam Tagradi, excellent drug for Pitta Shamana in Bisarpa, in pemphigus, in pemphigoid conditions. I have been using this Kottam Tagradi Kashaya, pemphigus or pemphigoid conditions, or in herpes zoster cases. Kottam Tagradi is used. Very easy to prepare. Only 6 ingredients are there in this yoga for external and internal administration for both. This is Nalpamaradi, which I told only in this yoga. Nalpamaradi yoga, externally used, has been specified in the textbook. But if Nalpamaram is the word, Nalpamara, Panchakshiri Vriksha or Panchavalkala, except Parisha, Vata, Udumbara, Ashwata and Plaksha. These 4 drugs make Nalpamaram. If we use these 4 drugs, Vata, Udumbara, Ashwata and Plaksha, we can give it for internal administration also. But if these drugs are added, Nalpamaram, these 4 drugs, together with Yashti, Ushira, Chandana, Durva, Nili and Tandulodaka, it is given externally. No internal administration is mentioned. And one thing out of the topic, this Nalpamaram for 7 or 8 cases of Perthes disease, avascular necrosis cases after Vasti, after Kshira Vasti, Nalpamaram internally I have been using with the good results. Not related to Visha, I think. But Nalpamara Kashaya, Vata, Udumbara, Ashwata, Plaksha, Kashaya is prepared, Chaturtha Avashesha Kashaya is prepared and given internally. Only with one principle, that Dhatu Poshana Krama, Mamsa, Meda, Asti, Majja are better managed with the Tikta Rasa Yukta Dravya. Most Tikta is this one. In the cases where a little bit Snigdhatva was required, case dependent, Gugula Tiktaka Taila is available. That was given for Prakshepaka with this Kashaya, 90 ml twice daily with 10 to 15 drops of Gugula Tiktaka Taila, Prakshepaka. Gives encouraging results. Lodra Sevyadi for Luta Visha, for herpes presentation, a little bit different from Neeli Tulasyadi. I told Neeli Tulasyadi is predominant Vata and Kapha Samsrishta with pain predominant, but Lodra Sevyadi is for Pitta and Kapha, where Kleda predominant condition and Puya Srava related conditions, Lodra Sevyadi is effective. Rest of the indications are very same. Nimba Nilavakadi Kashayam is a Vata Kapahara Virechana Yoga. Sonamukhi is there. That makes it Virechana. So first prescription itself we can write Nimba Nilavakadi Kashayam. It is Virechana as well as Vata Kapahara. In psoriasis it is useful. Neeli Karanjadi, again another drug mentioned in Mushika Visha Prakarana. In Mushika Visha Prakarana, Vata Rakta. One single terminology in Charaka Samhita he has mentioned as Vakhor Vishamiva Kruddham. Akhoho Vishamiva Kruddham. That is enough for deciding a Vishahara Yoga, the pain and the recurrence. Mushika Visha is classical comparison for recurrence of a clinical condition. Every Mushika Visha, if it is Sashesha, aggravates in Varsha Rutu. This is mentioned in Sushruta, Ashtanga Hridaya and Charaka. All these 3 authors have mentioned the recurrence of Mushika Visha remnants, the clinical presentation will be recurring in Varsha Rutu. So we need not tell that a case of recurring Vata Rakta, Raktavarana can be managed in the line of Mushika Visha. Neeli Karanjali is a very good yoga. Recently, 3 patients given in the last month, all are responding well in inflammatory monoarthritis presentations. Inflammatory monoarthritis presentations. This is a very effective yoga where inflammatory features are there and the joints are very limited. Now comes swelling and pain. These are all I have mentioned. If at all I need to explain, I can. Swelling and pain, Shigru Punarnavadi Lepa. This indication I have mentioned. What we do is 8 to 10 Arkapatra washed and dried, freshly collected Arkapatra kept one above the other, and then tied on first quarter, third quarter. Cut it into exactly half. We get 2 potalis of Arkapatra with us. We have to take a dry iron pan, smear oil to it or ghee to it, and then heat this potali of Arkapatra, and then keep it on local area. It manages pain very well. Pain management is very, very effective in this Arkapatra. So the pain will come down, and it is mentioned in Darvikara Visha for cobra bite, pain and swelling. Arkapatra Sweda is mentioned. Now for Vata Rakta, we need not think its effect. It will act very wonderfully. Now Nimba Neeli Karanja is an extensive used yoga in IP. Kashaya Parisheka of this in Kapha Vata predominant conditions. This one and Karaskara Kshira Parisheka. Karaskara is Kupilu. Kupilutvak and Patra Kshira Kashaya or Nimba Kashayas. Meaning out of it. Shirapaka is done, and Yutaila, it's a Taila yoga, Vishara yoga. Very complicated preparation, so I will skip that. Instead of that, these much yogas are there in our hand. Erithaila is a little bit complicated yoga. 40 ingredients are there. Preparation is also very laborious. It's my thesis drug, my PG thesis drug. Grita Saindava Parisheka. Grita and Saindava, enough. Heated and poured. Pain and swelling. Datura Phala Saindava Lepa. Datura Phala is taken and it is a small hole is made into it. Half of the seeds are removed and Saindava is added to it, and it should be boiled in milk. A potali of Datura Phala, half seeds removed, Saindava is stuffed into it and then boiled in milk. That once it gets boiled, prepare a kalko of that Datura and used for lepa. This is mentioned in the context of management of pain and swelling in Sarpa Visha Chikitsa. This is the yoga of Shigru Punarnavadi. Vata Kapaja, cellulitis and Rakta Dushti. I already told all these yogas are mentioned with ingredients 3 or 4 slides before. Cellulitis and Rakta Dushti. In Vrana, Kottam Tagaradi Kashayam, for almost all the Vrana cases, I depend upon Kottam Tagaradi Kashayam. They are Yashti Madhu, Tagara, Kushta, Chandana, Ushira and Sariva. Ingredients are, the slides are already shown. Parantyadi Taila is available in the market. During this lockdown period, I am trying to prepare Parantyadi Taila by myself. I have asked one of my friends who prepares medicine to prepare this. As the drugs are not available, kept pending. At present, it is available in the market. For vomiting, 2 yogas I will mention, which I practice in my OP. And this one, Dhanyaka, Bilva, Jeeraka and Sita Prayoga. Dhanyaka, Bilva, Moola and Jeeraka are crushed, not powdered, crushed. And then dry heating should be done in an iron pan. Once it gets heated, it should not be burnt. Once it gets heated, immediately remove from the fire and add 2 tender coconut water to it. Add 2 tender coconut water to it and allowed to dry and allowed to get cold. It is again squeezed very well after an hour, squeezed very well, and it should be filtered and then given muhurmuhu. Vomiting will stop. And especially in children, vomiting, it is very effective. Sita is the Prakshepaka Dravya. Another is Chandana Pana. Chandana Pana is not Chandana Kashaya Pana. Chandana Lepa, Kalka should be prepared. Chandana, we little bit of water is added to a pan, and then Chandana is grinded, and then Chandana Kalka will be available. This Chandana Kalka should be mixed with water, and that water should be taken, not Chandana Kashaya. Water should be taken. These 2 prayogas are very effective. And urine retention. One more thing, Bhumya Malaka prayoga is externally done. This is practiced by my teacher. If Bhumya Malaki is available, any of the audience, if Bhumya Malaki is available, Panchanga of Bhumya Malaki Kalka is prepared. Fresh Kalka is smeared to a cloth and tied around the neck. Vomiting will stop. This is a remedial measure for excessive vomiting because of giving Pavitra Vatakam. I told Pavitra Vatakam is a Vamaka yoga. If Vamana is in excess, Vamana is not getting controlled, to control that Vamana induced because of Pavitra Vatakam, Bhumya Malaka Prayoga is done. I am not using it. My teacher is still using this. Urine retention. Every time a case of hematuria or urine retention comes, Kushmanda stem, crushed Kushmanda stem, Kashaya is prepared. To that, Ela is added as Prakshepaka and given Muhurmuhu. It stops. It has not ditched me. It has not failed me. Many times it has been for help as a home remedy. Many people nowadays in lockdown period, they call hematuria or urine retention. If at all any Kushmanda stem is there, take Kushmanda stem, cut into small pieces, take a fist of it, put it into 2 glasses of water, boil it, need not reduce. And then to that Kashaya, Ela Churna is added. So half a teaspoon of, not even half a teaspoon, 2 Ela are enough. 2 Ela are enough. It is crushed very well, powdered and put and taken more. Sitar can be added. If at all Sita is there, Sita can be added. Otherwise, that is a very good remedy. For bleeding, I already told for hematuria, Shatavari Kanda Kashaya with Madhu. This is in English actually. For a case of hematuria, Shatri Kanda Kashaya is very effective, and Lajjalu Kshirapaka. Lajjalu Kshirapaka is more prescribed. Lajjalu, 4 glasses of water, 1 glass of milk dose every day, once daily. For a case of Adogata Raktapitta diagnosis, it acts very good. Excessive bleeding, not coming, not getting managed. As a home remedy, Shatavari Kanda Kashaya with Madhu and Lajjalu Kshirapaka are very effective. Now last one, Shirena Shiri Vrikshanam Kashayam Sasitam Kanam. Shirena Shiri Vrikshanam Kashayam Sasitam Kanam. This is also effective in bleeding. All mentioned in Mandali Visha Prakarana. Nase and Anjana, Bilwadi Vishalya, they told Purana Maricha, if at all Purana Maricha is not available, but if anybody is having Purana Maricha, Kapha aggravated condition in Unmada, Apasmara, or in the cases of severe nasal blockage and sinusitis, Purana Maricha a little bit, 1 pinch mixed with water and kept for some time, and then it is to be filtered, and that water is used for Nasya and Anjana, not Maricha as a whole. Maricha is used as a Kalka in Sarpavisha actually. In Sarpavisha, when patient goes for coma, Purana Maricha Kalka is prepared out of water and put Anjana. That much potency is not required. Simple, that mixed water can be given for Nasya. 1 drop, not more than that. And Bhrangaraja Swarasa is also effective. Bilwadi and Vishavadi Prabhata, Prabhata condition. Asya Vilvadi and Vishavilvadi with the Tulasi Swarasa. These are the formulations. Photo I have put. Vishi Vishari, Morvadi, Vilvadi, Vishavilvadi, all looks like this. Pavitra Vatakam. Next, Hridaya is a preventive cardiology. I told Ojasthan is to be prevented every time. And the concept of Garavisha and Doshi Visha and drug interaction. Just on the first chapter, Savisha Dravya Samyoga. As far as Viruddha is concerned, Avisha Dravya Samyoga. And the concept of recurrent and drug interaction and the ADRs, Doshi Visha in drug resistant conditions, in malignant conditions, and Viruddhahara in GIT manifestation, NCDs, lifestyle disorders, and Garavisha and Doshi Visha in genetic disorders and food poisoning. All these areas, there are enough scope for us. 1 or 2 cases may be coming to our OP in a year or in a month, but they are all very, very relevant. What is this? Can anybody answer? This is Martya Visha. Martya is also Visha. This is an elder sister, came to OP. Her younger sister bit her, and that bite mark has caused this much. So, Martya is also Visha. It is there is reference of Martya Visha in classical Malayalam Vishara text word, literally practically shown in the OP. Bit, and this is the lesion. Ananta param kila shabda shastram, solpam tatha yuhu bhavashcha vignaha, grahyam tata param apasya palguhu, kamsam yatha kshiram ibambu madhyat. I may have reached to you with these examples, theory and practical cases and medicines. So whichever has been relevant to you, whichever is more important to you, my humble request is to grasp all these things, just like Hamsa takes only Kshira from a combination of Kshira and water. These are my teachers who taught me Visha Chikitsa. The one who is wearing Chandana color, Gandha color, is the one whom I have been getting the medicines, who taught me how to treat Visha Chikitsa. Snake bite, Sarpakita, Luta, Vrishchika, all Visha Chikitsa. The first teacher, his name is Manmathan Vaidyar. He taught me managing Jangama Visha. And the one with white shirt is Prabhakaran sir. He taught me how to interpret the Visha Chikitsa in other cases. And my Samhita, I am highly indebted to my teachers of BAMS in STM Udupi. They have opened my eyes. They have been a constant inspiration for me, my UG teachers, especially from the Department of Panchakarma. I am highly, whatever I practice, indebted to Manmathan Vaidyar and Prabhakaran sir. By my due respect to these teachers, I am concluding my session. Over to organizers.
Thank you so much, sir, for a wonderful session. There are few questions. Sir, the first question is, you have mentioned many of the formulations now. Can we get these medications in the SDM pharmacy or any of the pharmacies?
We have to keep it. We have to prepare it. And I think a big laugh came from Gopikrishna sir. That is because practice is not easy. Practice is not easy. It's highly painful. And with that pain, the happiness we get is from the response of the patient. All the effort which we take in preparing medicine and fixing the case, that pain goes once the patient tells, doctor,
this is the first time that I have found result for this much number of days or months, and the condition has never recurred. They bring their children or family members to us, and then we ask, how is your condition? First you tell, how are you? Sir, I am perfectly okay. Then our breath gets easier, because when we see them, they are the reminders of our past, our experiments. So when they tell, the result is encouraging. So we have to take that pain, or else it's not so easy. If at all any difficulty is there, I can arrange to get these medicines, these limited medicines, from the one who supplies medicine to me. I can do that favor, but it is best possible once we start preparing it. We know the limitations of our medicines. So anyhow, I will try to provide these medicines from my friend who supplies me medicine, and from my teacher also. If at all it is available and he is ready to give, no problem in sharing the medicines.
Okay, sure. So the next question is, please repeat Trimurti Prayoga.
Trimurti Prayoga is the name given for Nimba Neeli Karanja Yoga. In Prayoga Samuchayam, a Malayalam textbook for Vishachikitsa, Nimba Neeli Karanja combination is mentioned as Trimurti Prayoga. And the Nimbatvak, Neelini Panchanga, and Karanjatvak, Kashaya is to be prepared if Prabhuta quantity of Kapha is involved, associated with Vata. If Pitta is the associated factor and an inflammatory response is very huge, we can shift the Kashaya Yoga to Kshirapaka and then use for Parisheka.
Okay.
That is only. That Trimurti is given for, that name given for yoga in that textbook. Kashaya and Kshirapaka are possible. Depending upon the condition, we can use.
Okay, fine. So there is a positive response from one of our delegates, is like they wish to have a series, paid session, online class for Vishachikitsa, sir. So it is for the organizers, and a wonderful session from you. So we have got this feedback from one of our delegates.
We will try. If my senior Gopi Krishna sir is telling, it's not the matter of paid or not paid, because Jnana, Chikitsa, Vyavahara should go on. But the problem is time factor. Anyhow, if Gopi Krishna sir is telling me, I am ready. I am ready, but because many areas are...
Need not tell. No, need not tell you. You are inbuilt quality. You are with my name. You are into this forum, incorporated.
Yes.
So, we will try, because the time constraints is the major issue. The hospital session has my teaching, UG, PG, and OP time is so hectic that I will try my level best. If if organizing is going on in an easier way, I am there. Definitely, I am there. We will engage.
Sure.
Yes.
So the next question is, name of the yoga for Mushika Visha.
Neeli Karanjadi Kashaya.
Okay.
Neeli Karanjadi Kashaya. And the yoga slides I will provide. Or else no need of taking screenshot or taking laborious task of writing it down. That's why I told in the first part of presentation itself, I will share today's presentation to the organizers, so that they can give it to all. No problem in it, because it's in Malayalam. It's very hard to follow. So those who are not following Malayalam, that's why deliberately I have translated all those yogas to Sanskrit. And thanks to my PG students, they prepared this Malayalam yoga, translated it into English, and the botanical name. Every chart is prepared by my PG students. They gave it by preparing, so that it was during the initial phase. I used to tell in slow, take the picture of that and tell it in Hindi. They told, sir, this is a laborious task. We will do one thing. We will prepare a chart for you and you present it to others. That resulted in getting these yogas into English. So thanks to my PGs.
Yes. Yes. So the next question is, please repeat Arka Potali and other indications of Arka.
It's used for external purpose in inflammatory monoarthritis. If we can't, first thing is we can't use it in a gross arthritis management, because more number of joints are involved means more number of joints are involved, it will be difficult. If 4 or 5 joints are involved, for example, we get a case where he is diagnosed as Vata Rakta and he is having swelling on the ankle joints, swelling on minor joints. It has come up to the knee joints, and on the phalanges he is having swelling and pain. Arka-Patra Sweda can be done. The procedure is freshly collected 8 to 10 leaves of Arka-Patra, dried, cleaned and dried, washed and dried, kept one above the other. It should be rolled. It should be rolled. Once it is rolled, the first quarter and the last quarter, from the length, the rolled one, 25% and 75% of that stuff, we have to tie it down. Cut it into 2 equal halves. First quarter and third quarter, as it is tied, it won't get separated. We will get 2 potalis and a small iron pan. We have to heat it by smearing it with the grita. And this grita lipta or heated pan, the Arka-Patra should be heated, just like we heat Patra Potali, Patra Pinda Sweda. The same procedure is to be followed. But one thing is there, depending upon the condition, we have to decide whether oil or ghee should be smeared to the joints or not. But for Patra, definitely Grita is required. If it is Vata predominant or Pitta predominant, plain ghee can be applied to the joints so that it will not get burnt. The area should not be burnt. Patient's joints also should be taken care of. If it is necessary, we can add, or else not necessarily. If Kapha Vata is dominating, we need not use oil to the body. Directly heat, keep that potali on the joint. Pain will come down. I think I understood.
Yes, definitely. Sir, many of our delegates want to get your contact details, contact number. So if we can pass it to them.
Oh, no problem.
Yeah, sure. I can share that in the chat. You can please share that in the chat box. If that is fine.
I will. Now itself.
Yes.
And 1 or 2 questions. 1 minute. Uh, 8589832350. Yes. And
okay.
My mail ID is this is my mail ID.
Sure.
And 1 or 2 questions I think.
Sir, one more question is on the difference of Krumi and Krimi. So if it is not taking much time, we can.
It's an elaborate discussion, because 2, 3 concepts come in between.
Yeah. Sir, I know Krimi is a very complicated and very different topic. If you don't mind, can you take 1 session on the whole Krimi sometimes whenever you're free? The whole of the Krimi Chikitsa. Sir, you need to unmute.
Sir, definitely.
Yeah, because the whole session on Krimi is very much required for the present day practice. And in case if it is possible, once you are relieved from the quarantine period or whatever it is might be, then you can go come up with. We don't want to stress you with more.
It's not a matter of stress. Stress is because I can't run around anywhere. I can't go. I have been tied here, and this is a problem.
Yeah.
In house, only network available place is on the first floor veranda, and I'm sitting there, and the main road is nearby.
Very
That
nice.
is the problem.
Okay.
That's why a lot of horn and vehicle sound were coming. No problem,
Sir, you can please give your convenient date. Once you give your convenient date, we can host the program on the Krimi Chikitsa. Anytime,
Yes,
whichever
sir.
is convenient to you.
Yes, sir. I don't have a
Yeah.
PPT of it. First, I have to prepare a PPT.
Sure.
I have to bring all the references together.
Yeah.
Sure.
I'll do it at the earliest.
Sometimes we can definitely go on with the Krimi Chikitsa.
Yes, definitely. Sir, so these are the questions for the day. So over to Gopikrishna M, sir.
Yes. Sure.
Sir, one more thing, I would like to have a sort of an extension from the questionnaires which happened yesterday. There are some patients who are unfit for Shodhana or Panchakarma. Like we had a concept of discussing like we need Shodhana, then come with the Vishahara Chikitsa. So what in case if the patient is Anaharya for the Panchakarma Chikitsa? Can we directly go for the yogas, or would you like to somehow see you want to go with a Sadhyovamana or Sadhyo Virechana or Alpa Shodhana and then conduct with the Vishahara Chikitsas?
Sir, if Shodhana Anarha patient is there in front of us, definitely there are two options for that. One thing, we can make him fit if he is an adult or a youth. If he is an old person or a small child, definitely we cannot do Vamana or Virechana in him. And we can preferably go on with the Shamana yogas. For example, I mentioned in that Taruna Bhaskara yoga. Taruna Bhaskara tablet can be given without doing Shodhana also. In the case of Vata Rakta or in the case of psoriatic arthropathies. In such, shall I turn my video off again? Internet connection is unstable.
Yeah.
In such cases, we can definitely go on with the Shamana Aushadhi itself. That Musta Ramachadi Kashayam, which I have mentioned there in psoriasis, or Nevi Karanjadi Kashaya Yoga, mentioned in the context of Mushika Vishaprayoga. Yoga. All those cases are managed in OP without doing Shodhana Karma. And many of those cases which we give Bilvadi Gutika or Visha Bilvadi Gutika are actually Shamana oriented treatment itself. Especially in the examples for a case of Urdhva Amla Pitta comes to us, and Ajirana factor is there. We are not having any drug, or a situation is there in front of us where we need Bilvadi Gutika, but the patient is having Urdhva Amla Pitta. We can prescribe a Bilvadi or Visha Bilvadi after food, without a Shodhana itself. First thing that I prefer is doing a Sadhyo Vamana with the Madhyashti Adi Kashaya, Madhyashti Kashaya, Madhyashti Phanta to be precise, because it's naturally a managing factor for Amla Pitta, and also it is Vamanopaga in nature. So both ways it acts. Then only I will start medicine. But in such condition where I cannot do Shodhana, I prescribe a Vishahara Yoga where I can get result, as well as Rasayana Yoga will also be there, so that I need not think of Shodhana in a further condition. Sir, I have answered it.
Yeah. Because many times it happens like either the patient is not ready for Shodhana or is unfit for Shodhana. The patient is having some other ailments, like might be is having abdominal hernias or something related to the cardiac pathology, where he is unfit for Vamana or Virechana. Then it becomes quite challenging in doing the Sharira Shodhana. and then going for any of the either the Visha Chikitsa or the Rasayana Chikitsa, then it becomes the condition is quite complicated. Because we cannot oversight the present illness, we cannot oversight the deformities already lived in that person. So it becomes quite a challenging in treating such patients as well. And most of them are Alpasattva nowadays. They are very sensitive. They are really not getting acquainted with the classical methods of Shodhana unless and until it is invariable. People are not happy with the chikitsa. Snehanam and Svedhanam is fine because they take it as a sort of a pleasure treatments. But Vamana and Virechana, it's bit, you need to convince the patient to a certain extent. Or it should be invariable condition wherein you have to convince the patient to a certain extent so that he happily accepts it. Because we don't want to conduct any of the treatments with force. It should be with the consent and convenience of the patient as well. So I think much of the things were being quite well established. So thank you very much, sir. It was a splendid presentation. It was almost an encyclopedia for the whole of the Visha Chikitsa for us. It was very nice. It was a complete set of treatments which was being incorporated in your presentation. And we would like to have more sessions from you. We would like to, we are always with a green flag. Whenever you are ready, you can please let us know. We will be hosting a class on the Krumi Chikitsa. We'll be most waiting for your call. So thank you very much for being with us. And for all the delegates, thank you very much for listening to us and being linked with Indian Institute of Ayurveda and Rasa Shastra. So thank you very much.
Thank you, sir. Thank you.